Hello and welcome back. Today we're talking about an issue that has had a profound impact on women's health for over 20 years, the fear and confusion surrounding hormone therapy, also known as hormone replacement therapy. We're going to explore what actually happened with the Women's Health Initiative study, what we now know, and why it's time to reconsider hormone therapy for perimenopause and menopause when used safely and appropriately. Hi, I'm Dr. Esra Shermadou, and I help busy professional women take charge of their health so that they can thrive in every area of their lives. If you're tired of conflicting information about hormone therapy and menopause, you're not alone. Today, we're going to set the record straight. There has been a common misconception for the past several years that hormone therapy in females is unsafe and generally bad. This fear and confusion surrounding hormone therapy started with the Women's Health Initiative. The WHI was a large government-funded study that aimed to look at the health of older women started on hormone therapy. In 2002, the WHI published a study suggesting that hormone therapy increased the risk of breast cancer and heart disease. This created fear and confusion that still affects how millions of women manage menopause today. But here's the problem. The WHI wasn't designed to study the treatment of menopause symptoms. It focused on chronic disease prevention using older hormone formulations in women who were mostly over 60 and well past menopause. Since then, further analyses and new studies like the KEEPS and ELITE studies have shown that the timing of hormone therapy, or when hormone therapy is started, is very important. You might hear this referred to as the timing hypothesis. Starting treatment within 10 years of menopause or before age 60 can lower the risk of heart disease, reduce risk of osteoporosis and fractures, improve insulin sensitivity, and even decrease overall mortality. Starting hormone therapy within 10 to 20 years of menopause has shown a neutral effect, meaning there was no notable increase or decrease in cardiovascular risks. But starting 20 years after menopause, when women are typically in their later 70s or early 80s, was linked to higher rates of heart disease and stroke. For women in the right age range, hormone therapy can be safe and effective and improves quality of life and overall health. Breast cancer risk is one of the biggest concerns that came out of the initial WHI study. However, in the WHI, estrogen alone, when used in women without a uterus, was actually linked to a lower risk of breast cancer over time. The increased risk was only seen with a combination of conjugated equine estrogens and the synthetic progestin medroxyprogesterone acetate. This may indicate that the small increased risk in breast cancer may have been due to the specific progestin used in the study. More importantly, newer data suggests that the use of bioidentical micronized progesterone may have a lower risk profile. Here's a critical point. All of these benefits and risks we're discussing come from studies that used FDA-approved regulated hormone therapy. These products have been rigorously tested for safety and efficacy. In contrast, compounded bioidentical hormones, or pellets, are not FDA approved and don't have the same safety data, which is why they're not recommended as a first-line treatment. Now, before we move on to discuss why all this is important, if you're finding this information helpful, please subscribe to the channel and share this video with someone who needs to hear it. And in the comments, let me know, what questions do you have about hormone therapy? I'd love to discuss it in future videos. When menopause symptoms like hot flashes, night sweats, sleep disruption, or brain fog go untreated, it doesn't just affect comfort. Untreated symptoms are linked to higher healthcare costs, more missed workdays, and even leaving the workforce early, which can impact your overall health and economic well-being. Even more important is the effect that this has on women's health: increased risk of cardiovascular disease, fractures, depression, anxiety, and even death. This not only affects women personally, but also close family and friends around her. The WHI study led to a lot of fear, but newer evidence has given us clarity. For healthy women under 60 or within 10 years of menopause, hormone therapy with FDA-approved medications is a safe and effective option to not just manage symptoms, but to support long-term health. Not all women will want to be on hormone therapy, and that is completely fine. However, you deserve the ability to make a choice based on accurate information, not based on fear. Don't let outdated information hold you back. Talk to a knowledgeable provider about your options and find a plan that works for you, because your health is worth it and you deserve to feel your best. All right, that's it for now. Thank you for watching, and make sure you share this with a friend, sister, or mother who needs to hear this. And check out my blog for more topics like this and other ways to improve your health.